my name is Kayla Nunes. I'm going to be your speech language pathologist for the day. Your name is?
Mora.
Okay, nice to meet you. So you are here for an oral mech exam. Are you familiar with what an oral mech exam is?
No.
Okay, so I'm going to give you a little brief explanation. So essentially, the oral mech exam is used to evaluate your oral motor skills, specifically monitoring the movement of the muscles of the face, such as the jaw and the lips, as well as the movement of the muscles of the oral area, like the soft palate and the tongue. So we're going to begin by compiling a brief case history. So can you just tell me your age and gender?
19 and female.
Okay. Any medical history contributing to articulation or swallowing problems such as dental or oral surgery?
No.
Okay. Any prior speech therapy?
No.
Okay. Any complaints about your speech or swallowing?
No.
Okay, awesome. So far as we're conversing, your speech seems pretty normal, but we're going to be assessing that throughout this oral mech exam. Now, do I have permission to touch your face?
Yeah.
Okay, awesome. Okay, so the first structure that we're going to work on is the jaw. So in order to assess range of motion of the jaw, I'd like you to open your mouth as wide as possible and close it, and just keep doing that for me. Okay, and then for strength, I want you to open your mouth big and wide like before, and I'm going to have my fingers on your chin. At first, I'm going to try to be closing your mouth, okay? So open it big and wide. Okay, and then on the opposite end, keep your mouth open as well. I'm going to be trying to open it further, but I want you to keep it at the openness that it is currently at, okay? Okay, awesome. And then for symmetry, can you just move your jaw from left to right and then try to protrude it as best as possible? Okay, good. So, cranial nerve innervation for the jaw. So motor is innervated by the cranial nerve number 5, so the trigeminal nerve, and then sensation is innervated by cranial nerve number 5 as well, so again, the trigeminal nerve. Moving on, we're going to work on the lips. So in order to assess range of motion of the lips, I'd like you to pucker, so kissy lips, and then smile, and just keep doing that for me. Okay, good. And then for strength, I want you to purse your lips. So hold them in as tight as possible. And I'm going to have my fingers on both sides trying to open, okay? But I want you to keep it tight. Right. Okay, awesome. And then for symmetry, can you just smile big for me? All right, perfect. So cranial nerve innervation for the lips. So motor is innervated by cranial nerve number 7, so the facial nerve. And then sensation is cranial nerve number 5 again, so the trigeminal nerve. All right, now onto the soft palate. So in order to assess range of motion of the soft palate, I'd like you to open your mouth wide, stick your tongue out, and say, ah, 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 so a broken ah for me, okay? So,
Ah, ah, ah.
All right, good. Everything looks good back there. And then for strength and symmetry, same exact thing, but this time I want a sustained ah, so ah.
Ah.
Okay, good. Okay, so cranial nerve innervation for the soft palate. So motor is innervated by cranial nerve number 10, so the vagus. And then sensation is innervated by cranial nerve number 5, so the trigeminal nerve once again. And lastly, for the tongue, to assess range of motion, I'd like you to stick your tongue out, move it up, down, left, and right. Okay, good. And then for strength, if it's okay, I'm going to have my fingers on both sides of your tongue, and I want you to push against the resistance of my finger on either side, okay? So left, good, right, and then push against my finger for the tip. Okay, good. All right, and then for symmetry, just stick your tongue out. Good. So cranial nerve innervation for the tongue. So motor is innervated by cranial nerve number 12, so the hypoglossal nerve. Sorry. And then sensation is innervated by cranial nerve. Well, so the anterior 2/3 are innervated by cranial nerve number 7, so the facial nerve. And then the posterior 1/3 is innervated by cranial nerve number 9, so the glossopharyngeal. Okay. So now that we're done with the oral motor exam portion, we're going to move on to the diodocokinetic task, so the DDK task. So do you know what that is?
No.
Okay, so it's basically used to assess the rate and regularity of your speech and assess the ability of your articulators to move in certain ways to produce certain sounds. So the sounds that we're going to be assessing are p, t, and k. in isolation and then connected. And we're basically targeting the movement of the muscles of the jaw, the lips, the soft palate, and the tongue, which we just assessed in the oral motor portion. So if you could just open this for me,
Yeah.
just so we can time you.
There you go.
Okay, perfect. So to start, I would just like you to say put, 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 put as many times as you can and as fast as you can in 5 seconds, okay? And once you're done with that, I'm going to be assessing to count how many reps you had within those 5 seconds, okay?
Sounds good.
Ready, set, go. All right, awesome. So the norm would be 15 reps in 5 seconds. Now, I don't know exactly how many reps you had, but you definitely exceeded that. So looking pretty normal. Next up, ta. Okay, so same exact concept. Just say ta, ta, ta as many times as you can and as fast as you can. All right, ready, set, go. All right, perfect. And then ka. So same exact thing. All right, ready, set, go. I know that one's a little challenging, but you got it. Okay. I think you were within the norm, but again, I'll look at that later. And now can you just connect those 3 sounds? So pataka, 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 as many times as you can within 5 seconds again. Okay. Ready, set, go.
Pataka, 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 pataka.
Okay. That was good. It can get a little challenging as you go on. Again, the norm would be 5, and I think that you well exceeded that. So awesome job. That's it. That's all we have for today. So do you have any questions for me?
No.
All right. Thank you so much for letting me do this on you, and I hope you have a great rest of your day.
Perfect. Thank you.